IAPT is the Improving Access to Psychological Therapies programme. It's a national programme run across the Department of Work and Pensions and the Department of Health. And around the country there are many services like ours providing services for people with common mental health problems, problems like anxiety and depression. In Lincolnshire we have 9 primary care mental health teams around the county, all working to a stepped care model in line with the national programme.
I think it's really important for all PCTs to look at this area. Depression and anxiety is a major common disorder, has impact on individuals, families and communities and on the socio-economic issues in our lives. So people can't work, they lose jobs. Well, here in the East Midlands, there's really strong enthusiasm from commissioners. So we, the Strategic Health Authority, worked with those commissioners to start to build a picture across East Midlands of what the need was and for them to build local service specifications, driven by a desire to make sure that we could put quality services in place with our providers.
The IAPT service has come on in leaps and bounds in this area. We've recently appointed 34 IAPT workers, and that delivers a much greater variety of options to patients than we ever had available to us previously. The differences that IAPT has made to my patients have included a dramatic reduction in waiting list times and also much greater treatment choices available for them, particularly with mild to moderate conditions. And as a GP, a major improvement has been that I've been able to deliver interventions in line with NICE guidelines for patients with mild to moderate anxiety and depression.
I've been dealing with depression now for over 10 years and I just needed a bit more help and support with it. I actually admitted that I'd got a problem and wanted sorting out. It's really changed my life. I was struggling before with my 2 daughters and everything else was getting to me. I was getting stressed about the tiniest, simplest of things and I'm a bit more laid back now. Just every day it's like work was bothering me, there's been some issues that have covered on that, and it's just in general everything's a lot better. If anybody gets a chance to do any talking therapy, I'd definitely recommend it.
I think IAPT's produced a lot of changes in the way that the primary care team functions really. I mean, I think the rationale behind it, wasn't it, was to improve access to services. And I think what we've seen over the years is that the teams become a lot more integrated. We work, you know, low and high intensity colleagues working with nursing staff as well as psychology. So I think the changes that IAPT has brought have been very positive.
Working in partnership creates much better care because we work in a multidisciplinary team. So we have nurses, counsellors, psychologists and CBT therapists on hand to discuss more complex cases, but also to create a smooth transition for our clients so they can move through the process if they need further interventions. Also, close working with our GPs and our voluntary partners has been really important. We can create seamless links for our patients and hopefully provide a whole package of care.
If we have effective interventions, then people should have a right to have access to them. And for depression and anxiety there is NICE guidelines which manages what research is available. And we know that patients, their experience is massively improved by coming through these services. And last is there is a real quality productivity issue here, that these types of services can treat large numbers of people effectively. And I think there's a really good cost-benefit argument for why we should be doing it and why all PCTs should be.
Getting the news about these sorts of services out to all GPs is incredibly important because they see an awful lot of people with common mental health problems. Some people with physical health problems also present with depression or anxiety alongside that. And if they know these services are in existence, they can make sure people are able to access them. All of us, I think, at times know what it's like to experience anxiety, depression, maybe not to a clinical level, but for those of us who do, we need quick access to those services.